Great. Good evening, ladies and gentlemen. Good evening. Mr. Bornwell, from Zimbabwe. Well, Mr. Bornwell, which account number you're using? You can just give us a call. So we'll set you as the co-host. Once again, good evening, ladies and gentlemen. We have introduced two new products into African market. The first one is the women care gel. In Africa, actually, we have two wonderful products for women. One is the uterus cleansing pills. In some of the market, they use the women care gel. So today we have invited one of our wonderful trainer from Kenya, Madam Macharia, who's going to present us the women care gel. After her presentation, you may ask questions and we may invite our audience to share. Madam Macharia, after your presentation, please give me an opportunity. I would like to share how we use this okay, after your presentation, we're going to invite Mr. Bornwell from Zimbabwe to present the second product, the bone care plaster. Well, after his presentation, I'm going to share about my personal experience with this bone care plaster during the leaders camp in Kenya. So, Madam Macharia, let's start your presentation about the women care gel.
Good evening, ladies and gentlemen. Welcome to today's Madam Hannah Macharia or Mrs. Macharia from Kenya region. I'm a proud distributor of Green Health and a privileged one, a 7-star consultant and also a regional trainer in Africa. Today, I'm happy to be given this opportunity to talk about one of the best products we have for women in worldwide. It is a product, I can call it's a gold, because it's a product that we have been waiting in the market with other products. And when I'm going to talk about this product, specifically it's for women. And I'll give some of the examples of how our women or us women, we are very, very important in the society. And that is where you find that even our countries, they are not called he, they are called she, because they can bear. And when also we talk about our countries, we know that we have our palace, or we have, if it is a palace or a state house, every country has a state house or a palace. And when it comes to a state house, it is one of the places that is surrounded with soldiers, policemen. It is very much protected. And before you reach that you're going to attack state house, it is very, very difficult. And even if it is attacked, if you hear that your state house has been bombed or has been there's an attack in your state house, you will understand that in that country, a lot of people will say they are done or they are dead, because that is the area that is very, very much protected. The same thing with the women. They have a palace, and this palace is very, very much protected. And the same thing in a state house. You can stay for a long time without not going out because the food is there. You can swim. You can stay like months without not getting hungry. The same thing with women. We have a palace, and this palace it is very much protected, and also remember it bears, or you can it grows of the child that is born through that palace, and that child stays there for 40 weeks or 9 months, and there's no day the child can say, wake up, my mom, I need to eat, my mom, I want to go to pee, I want to play, I want to jog. They stays, or that unborn child stays there for 9 months or 40 weeks. So this palace is very, very protected. But at the same time, when a woman is found that she might be having a gynecological problem, they fear, they see like their life is at the end. And that is where, as Green Health or as health consultants, we talk to our women and tell them when a palace has, it is attacked, there is also an opportunity of you living your life to the fullest. The same thing when a state house is attacked, we have so many soldiers. Even other countries, they might send their soldiers to come and help you to protect your country. So this palace has a lot of attack from areas around it. And most of the time, they have the gynecological diseases. And that is why we have gynecological doctors, but men don't have their doctors. But as women, we have a special doctor who we call them the gynecological doctors. And there are some of the diseases that affect our palace. There are some of the diseases. We have the fibroids, we have the ovarian cyst, we have the UTI, urinary tract disease infection. And with the urinary tract infections, it is an infection that is caused by a bacteria from the poo entering the urinary tract. And you know, the urinary tract for ladies is a bit shorter than for women, than for men. So that's why the UTI affects women more than men. So UTI is among, and we have some types of UTI. We have trichomoniasis, we have syphilis, we have gonorrhea, we have some types of urinary tract infections. They are cystitis. Cystitis affect the bladder. Cystitis affect the bladder. We have the urethra, affect the urethritis, affect the urethra. We have the one that has killed a lot of ladies, especially in Kenya. That is the kidney infection. And we have the vagina. Those are some of the types of the urinary tract infection. Also, we have the STD. STD and UTI can affect.
Sorry, madam. Sorry for interrupting you. Can you please scroll down the slide? Okay. We're still on page number 1. Yes, thank you.
Right.
Thank you.
Thank you. So, as I was saying, we have so many gynecological diseases that affect the palace. That is we have the ovarian cyst, we have the fibroids, we have the endometriosis, we have the ovarian cancer, we have the cervical cancer, we have the UTI, we have the sexual transmitted diseases. Those are some of the types that affect the the female reproductive system, or the palace. I'll call it in quotes the palace. And this is where we find that women play very important roles in the society. That's why I said we are very, very important in the society. And that's why the country is called she and not he, maybe. Also, with a fast-paced life, women bear burdens not less than men. True, they bear a lot of burdens and not even less than men. Gradually, they have healthy problems which they likely ignore. And there is one thing I will say, that we like proscanating. That is, we need to say, I'll go to the hospital tomorrow. I have pain in my abdominal. I'll go tomorrow. I'll take painkiller tomorrow. It is prolonged. After that, it becomes a bigger issue or a bigger disease. One of the common gynecological condition may develop, I said there are so many, it is cervical cancer. It is cervical cancer. According to WHO, World Health Organization, cervical cancer kills more than 300 women every year. It kills more than 300 women. That means one woman is killed by cervical cancer every 3 minutes. In every 3 minutes, one woman is killed by cervical cancer. And cervical cancer is caused by a virus. It's called the human papillomavirus. And human papillomavirus is the one that causes the cervical cancer. This is the palace. You can see this is the palace, or the reproductive system, the female reproductive system. You know the structure of the female reproductive system? This is it, or the palace. And you can see we have the ovary, we have the cervix, we have the vagina, and also we have the uterus. We have the uterus. That is the structure of the female reproductive system. Factors that causes gynecological conditions. There are things that causes gynecological issues. One of it is the excessive cleaning. Excessive cleaning. Excessive cleanings, mostly, so many ladies don't believe that if you cleaning with only water, not using soap wash or soap or lotion. They think you are supposed to use a lot of soap because maybe you're having some discharge. It is not okay. The palace cleans itself. So excessive cleaning mostly interfere or distract the natural weak acid. That palace has its own acidic, the pH of it. It is a weak acidic, and it is not supposed to be interfered. So for us, we use soaps and etc. others. So excessive cleaning interferes with the acidic of the palace. Also, we have prolonged sitting. We have those people who stays in their offices from morning to the evening. And most those ladies who sit from morning to the evening, it affects the circulation. It causes circulation problems. It causes circulation problems in the palace. Another one is wearing underwear made from chemicals. Wearing underwear made from chemicals. These one, they cause a lot of dampness. They cause a lot of dampness in that area. At the same time, that dampness leads to excess bleeding of bacteria. Excess bleeding of bacteria, and excess bleeding of bacteria can lead to infections, etc. Multiple abortions, those who have multiple abortions also, it affects the condition of, it results to gynecological issues. Those people who have frequent sexual life, or like the human papillomavirus, it is all the sexual transmitted diseases or infections. They are caused during intercourse. And HPV can be carried from a man to a woman. So frequent sexual life, those people who keep on changing their partners, it is not advisable. Also, work pressure. Work pressure also affects the gynecological conditions. Those people who work with work pressure, those people who work in a congested area, those people who have a lot of stress because of the work area, also work pressure can cause gynecological issues. And many gynecological issues condition start from the vagina opening, then infection would go up to the cervix, fallopian tubes, ovaries, and even uterus. Those gynecological issues, because of the opening of the vagina, the infections, they would go up. As I said, for us, we have shorter, not like men, they have longer. So the infection transfer up to fallopian tubes, to the ovaries, and also transfers even to the uterus. We have our very nice products that I'm going to talk about it. That is the Women Care Gel. Women Care Gel, I'll say keep your privates clean and healthy. Make sure you keep your private parts clean and healthy. And it has its main ingredients. It has its main ingredients. We will talk about them. Those are some of them. We have the fructose, we have the cortex, we have the Chinese rhubarb. Those are some of them. And the ingredients, those ingredients, they help. They have the benefits. They help. Number one, they help to inhibit bacteria vaginosis and reduce reduce. Sorry for this. Just a minute. And inhibit bacteria vaginosis, and reduce odor. That is a smell that comes from our palace. Inhibit bacteria vaginosis, reduce odor. We have reduced the occurrences of trichomoniasis. Trichomoniasis is one type of STD. We have sexual transmitted diseases that comes from sexual transmitted infections. One of these it's trichomoniasis. We have syphilis, we have gonorrhea, we have chlamydia, etc. Also, remove heat and dampness, relieve itching, and reduce urticaria. Relieve swelling and pain, and promote tissues repair. We'll come to see about them. Help maintain the weak acidic environment in the vagina and promote local immunity. When it comes to those ingredients made from our Women Care Gel, those are the benefits. And I'll talk one by one. Number one, it inhibits bacteria vaginosis and also reduce odor. Radix, aloe vera, bromide, cortex, and Chinese rhubarb are of antibacterial and anti-inflammatory effects, which help reduce vagina secretion and unpleasant odor. And most of the time with vaginosis, we have bacteria vaginitis that affects our uterus or our palace, and it happens because the natural bacteria goes up or up, the levels up. And with these, radix and aloe vera and cortex and Chinese, they help because they are antibacterial. They help to make sure that the anti-inflammatory effects, which help reduce the vaginal secretion and unpleasant odor, they make sure that the unpleasant smell or vaginal secretion, it is reduced. That is the first one. It helps to reduce the unpleasant smell. Number two, helps reduce the occurrences of trichomoniasis. Trichomoniasis, I said, is one of the STD. And this trichomoniasis is one of the STD, I would say, we fear a lot, because in both men and women, it can cause, in men, it can, if it stays for a long time in the body, it can cause prostate cancer, and in women, it causes the cervical cancer. So trichomoniasis, one of the ingredients that helps to reduce the occurrences of this STD, kuseng, fructisis, radix, and aloe vera, they help to kill the parasite and also help to regulate immunity of the private parts. And you know, when it comes to cervical cancer, immunity is like everything. Make sure with the product also, you give something to boost the immunity. If a person has been diagnosed with cervical cancer, immunity. Also, if that person wants to prevent themselves from getting the cervical cancer, make sure the immune system is very good. So the kuseng, fructise, and aloe vera, they help to kill parasites and also help to regulate immunity for the private parts. That is number two. Number three, help to remove heat and dampness, relieve itching, and reduce urticaria. Urticaria is the white discharge or the green discharge or the yellow discharge that a lady can get through the underwear. We can see through the underwear. And our women care gel has kuseng and cortex. They are commonly used to relieve skin itching. And also fructise seedi helps remove dampness, dispel weed, and kill parasites. Dampness can come because of sitting too long, can come because of putting staying with a pad for some time, and also the humidity around the area or the environment around the area as we stay as ladies. So help to remove heat and dampness. That is the third one. And these are the ingredients that helps to remove and kill parasites that can result to urticaria. Number four is help relieve swelling and pain and promote tissue repair. Those people who have regular sex or intercourse, or they might have or those people who have reached menopause. There sometimes you find a lady when you're interacting with them and you're talking about the hormonal imbalances and what are the signs and symptoms she's getting from menopause. And one of them, they could say that it is dryness. So, in the palace, when there's some dryness and you have a very nice product that helps with that, the silver spray for ladies, when there's some dryness through that part, one thing, pain can occur, and also might have a wound. So with those people who have reached menopause and those people maybe they have they might not be able to communicate directly, but you can understand them. They have partners, intercourse partners, sexual partners, multiple of them. They might have the pain and also swelling and pain at that palace. So Women care gel has ingredients that helps to relieve swelling and pain. And that is Bornwell and Coltex. They help to relieve swelling and pain. Aloe vera can help alleviate pain and promote healing. It helps to alleviate pain and also promote healing. So the more we're talking about our women care gel, you can understand it's actually among, we have the uterus and we have the women care. It is among the gold products we have in our market. Also, help maintain the weak acidic environment in the vagina and promote local immunity. As I said, that place or the palace has its own acidic rate, and the pH, and it ranges from 5 to 7. So when we have used soaps to clean there, or other things, you find that as ladies we use a lot of things just because it is smelling a bit not okay. So we use like so many soaps or detergents. So it is good to understand that our private part or that palette has its own environment, has its own acidic. So, and or has its own smell. So when you're using a lot of soap, you interfere with acidity. You interfere with the environment of that place. At the same time, when there are some other parts we use, and you can have inflammation, or you stay a lot with panties which are unclean, the underwear which are unclean for some days. So those are some of the things that can interfere with the weak acidic. So it results to dampness at the same time. And with our with our Greenwood Women Care has ingredients like domifen bromide is an topical anti-infective. Its pH value is between 5 to 7, which is acidic and friendly to vagina environment. So it is very friendly to vagina and environment. How to use our women care gel? How to use our women care gel? Use 1 tube every evening for 3 to 5 days. 1 tube you can use from 3 to 6 days. Also, ladies with those serious symptoms, serious infections, they can use 1 tube in the morning and 1 tube in the evening. Not for ladies in menstrual period, lactating, or pregnancy women. So they can use, for those who have a serious issue, they can use 1 tube in the morning and 1 tube in the evening. And also they can, and also for those who have no issues, just wants to keep the place very awesome, for those who might be very dry, they can use it 3 to 6 days, and not for ladies who are breastfeeding or lactating, or those who have menstrual period. So this is a gold product for us women. Make sure you use. Actually, the time this product arrived, so far I have given so many, and only one woman who gave me the referral of around 10 ladies. Why? Because when you treat one, they kind of have a group which they communicate, or a charge group they meet and talk, I have some issues, I have an infection. So make sure you share the product. It's a nice product, and help those people who need it, and use it. Use it to gain experience. Thank you so much. I hope you have learned, and asanteni sana. Welcome, Madam Reni.
Asanteni Tana, Madam Macharia. Thank you so much for your wonderful presentation about the women care gel. Do we have any questions about these products? Before we go to the next presentation, the bone care plaster, let's invite the questions. How is it applied? Okay, it is like a syringe, you just open it and, put this into the vagina, actually make the point of the syringe going to the, going to the vagina, try to push it in, and then you inject the gel into the vagina. This is how you use it. Thank you so much. Do we have any more questions? How much is this product? We don't have it in Cape Town. Oh, okay. Well, according to this, you may talk to the management, because we know that in South Africa you have another wonderful product, which is the uterus cleansing pill. That product also works perfectly on women's gynecologic problems. So if you have the uterus cleansing pill, you can use that product. Would it help strengthen a weak cervix? Well, we need you to clarify, what do you mean by weak cervix? Do you mean by the infections of the cervix? If you mean the corrosion or infections of the cervix, the answer is yes, it does. It cleans, and also it is antibacterial and also anti-inflammatory, so it can alleviate the corrosion or the infection of the cervix. Okay, recommended age. As long as, this is how to say, as long as this lady is old enough, is married, is not a virgin anymore, she can use it. Okay, let me see more questions. No, we don't recommend uterus cleansing pills or the women care gel to pregnant ladies. No, because it could increase the risk of miscarriage. So no, please never recommend either these products to any pregnant ladies. Now let's go to the next one. Can a person do intercourse using it? Well, this is also a very good question. Uh, we don't suggest any ladies have intercourse when you're using either the uterus cleansing pills or the women care gel. Well, in terms of this, you could understand the big difference between the two products is number one, the ingredients. Number two, the course. Remember, the uterus cleansing pill contains actually six pills, and each one is going to stay in the vagina for 72 hours. And after you take it out, you allow your body to rest for 24 hours, for 1 day. So that is to see each pill goes for 4 days, counting on the 1 day off. So 6 times 4, that is 24 days. And we ladies, if you are still have periods, then normally you have 5 to 7 days of menstruation per month. So that is to see, the uterus cleansing here actually covers the 1 month's course. Okay, let me thank you. So please you mute yourself when you enter this Zoom meeting, so our audience may listen well. Now let's take a look at this women care gel. Remember, Madame Macharia has shared with us that each one, it actually goes for 1 day. How many one is in the boxes? So actually we also have 6. So it depends on the severity of your problems. So if your problem is mild, you can use one of the women care gel per day. So it's going to last for 6 days, right? You can use it continuously. That means day by day. You allow it to stay in the gel to stay in the vagina for 24 hours. And then the following day you repeat. You use the second one. So if your condition is more more severe, you can use two, one in the morning and one in the evening with a 12 hours with a 12 hours. So in this case, it means that the whole package can last for 3 days. So this is the great difference between the two products. One can goes for the whole month, and the other one is going to give you 3 days to 6 days course. So this is how to use the women care gel. Now let's go to the next. Is women care? Oh, I think I answered your question. There are two big differences. Number one, the ingredients. The uterus cleansing pill, we mainly use the traditional Chinese herb. Some of the ingredients are the same. So you will realize that actually the cushion, the fructus needii, the radix stemoni, and the angelica sinensis. So these ingredients, they exist both in the uterus cleansing pill and also the women care gel. But in women care gel, we put something else like aloe vera, borneo, domifene bromide, and also we put the cortex, philodendron, cortex, pseudolaricis, and Chinese rhubarb. So all these herbs and the domifene bromide makes these products works faster than the uterus cleansing pill. So that is to say, if you want a fast result, you use the women care gel. But if the infection is chronic, like the chronic cervix erosion, then you'd better go for the uterus cleansing pill. So this is the difference of the two products. Okay, then can someone with rash in the vagina also use the gel and the cleansing pill? It depends on what caused the rash. If the rash is caused by the infection, like the bacterial or fungal infection, then yes, you can, because the rash is caused by the pathogens, and both the products are designed to kill the pathogens. But if the rash is caused by allergy, because some ladies can be allergic to, like Madame Macharia has shared with us, some ladies may use soap, may use some detergents to wash the private parts. Then this could cause the allergy and rash. So if it is caused by allergy, then please don't use this. You wash the private part with water, and then you allow the rash to go. Then you can use these products. Can someone who is HIV positive use uterus cleansing pill? Yes, it can. Yes, they can use it. But the uterus cleansing pill or the women care gel, neither of them can cure the HIV/AIDS. So this, you must make it clear to your customers. Okay, so thank you very much, Madame Macharia, for your powerful presentation. I think we can invite Mr. Bornwell from Zimbabwe to present the second product, which is Bone Care Plaster. Thank you very much, Madame Macharia. Thank you once again. Mr. Bornwell, can you please unmute yourself? Thank you. Thank you, Madame Macharia. Thank you. Mr. Bornwell, please unmute yourself and you can start sharing your screen. Or if you need my help, I can help you to share my screen. Yes, yes. Mr. Frederick Macharia. Yes, this was a wonderful presentation. I totally agree. Thanks. Thank you. It seems like Mr. Bornwell, I need to log into the Zoom to help you with this. So, are you sure that you want to use the AI companion? Because I actually Mr. Bornwell, are you going to share your screen? Mr. Bornwell, please unmute yourself. Mr. Bornwell, yes, your microphone is on. I can see that. So you can share your screen. Hello, Mr. Bonwell.
Miss
Mr.
Rainey,
Good evening, Mr. Bonwell.
you
Thank you
see,
very much.
I'm using the PC,
Okay.
so you are muting the cell phone.
Okay, please. Are you going to
Uh,
share your screen?
Miss Rainey, do you see my PC?
Mr. Bonwell, you must have two devices on,
Yes.
because we can hear the echo. So please you switch off one of the device and leave one device on in the same room.
Okay, it's okay. I'll do that now.
Oh, okay. We can't see your screen yet.
Okay.
Are you going to share your screen? Or you want me to do that for you? I can help you. Mr. Bonewell, are you using your PC? Yes, thank you very much. Thank you. I agree. Thank you. We see a lot of audience, expressing their thankfulness to Madame Macharia. Yes, thank you. Thank you very much for this. Yes, let us see whether we have more questions while we are waiting for Mr. Bornwell. Yes, thanks. That was quite good. Yes, thanks. That's very true. Thank you. Thank you. Thank you. Thank you. Let me check. Yes, let me check. Let me check. Mr. Bornwell now is the co-host. Mr. Bornwell, hello. Oh, thank you for reminding me. Mr. Bornwell. So I'm sorry for that. It is me actually. I said Mr. Macharia is the co-host. Sorry, I'm sorry for that. Okay, great. Now we can see your screen clearly. Where are we going to find these products? Okay, ladies and gentlemen, after the presentation, if you find that this product is going to help a lot of people, please kindly talk to your management. This product so far is available in Kenya. Mr. Budiman, is the bone care plaster available in West Africa?
Bone care plaster, so far, we don't have the bone. It's been a long time, actually. We don't bring
Okay.
in the bone care plaster.
Okay, thank you so much. Ladies and gentlemen, it is so far available in Kenya, and it was in South Africa and West Africa for some time. So if you find these products help, you may ask your management to bring into your market, because we realize that this product works very well. At least, it works well on me and another top leaders in Kenya. I'm going to share with you after the presentation by Mr. Bornwell. So Mr. Bornwell, are you ready? Hello, sir. Are you ready? Mr. Bornwell, are you ready? Your mic is on. Yes, we can see the screen very well. We can see you scrolling the slide.
Yeah, we cannot
It's
hear
good.
your voice.
But we can't hear your voice. Make sure that your microphone is on, because from the screen we can see it's on. Mr. Bornwell, we can't hear your voice. Check your speaker, check your microphone. Mr. Bornwell.
God.
Mr. Bornwell, we can't hear you yet. No, detox pad is completely different from the bone care plaster. Detox pad, from the name, you understand it is for detoxification. It is put on the sole of your feet. Most of the time is when you're sleeping, because if you put it on the day, you'll feel uncomfortable. But bone care plaster, from the name, you get what it does. It does for of joints, bone and joints, especially joints. So if you have knee pain, wrist pain, any joint pain, you paste on it on the painful joint. So it alleviates the swelling joints and the pain. So actually it is for joint problem. Mr. Bornwell, we cannot hear you.
I can give some suggestion, Mr. Bonwell. If you can use also your mobile phone just to catch your voice.
Yes, I can. I can help you share the slide,
Mm.
so you can use your mobile.
I think it's
Okay.
the setting in the laptop.
Okay, let me. Okay, Mr. Bone.
Hawu, usithatshani umyuthi ngayiwe.
Awuqalise ngobeka.
Nangani njini ikhamba?
Awuqali ngobeka.
Or we can do like this, Madam Reni, can you stop sharing because you are the host? Stop sharing, and then maybe from your laptop you can start to share the slides,
Okay, let me
and
do
then
that.
later, yeah,
Yeah, let me do
yes.
that.
So then, Mr. Bonwell, you can start maybe using your mobile phone. It's okay as long as we can hear you.
Sorry, Mr. Bonewell, I start sharing the slide on my screen, so you may proceed doing your presentation. Is that okay to you?
So, Mr. Bonwell, you can log out from your laptop and then log in again using your mobile phone.
Mr. Budiman, you can share this information. You can text him and let him know that
Okay.
he can switch off his PC and use his mobile phone. So I'll help him to share the screen. Ladies and gentlemen, when we are waiting for Mr. Bornwell to get his gadget set, so let me, not wasting of time, I start sharing my personal experience, my testimonies with this bone care plaster. We visit Kenya in November last year. Together with Dr. Deming Lee, Mr. David Zhang, and Professor Zhang. In Kenya, we had a very successful leaders camp. Madam Lucy, Mr. Mbogo, and her team, we had the outdoor team building during the camp. It was so wonderful. I remember one of the outdoor activities was jumping the rope jumping. Actually, I was the number one. I was the first one in my team that were having contacts with the other team. And then, I jumped. I really wanted my team to win. So I jumped 90 without stop. Then after that, I have, after that, we have another contest. It is run. We run for 50 meters and then we run back. So you got to understand I'm 52 and I'm a bit overweight. So, my joints actually, especially my knees, carrying on extra loads of my body weight. And I really ran fast and I jumped 90. And then in the evening, when we went
Madam Rainey,
inside.
Mr. Bornwell
Yes?
is here.
Is
Mr.
Mr.
Bornwell
Bornwell
is here
ready?
using his mobile phone.
Yeah, I think I'm ready. I'm ready here.
Okay.
Mr.
Then I will save this. I'll save the the most exciting part after your presentation. So, ladies and gentlemen, let's welcome Mr. Bornwell from Zimbabwe to give us a wonderful presentation on the
No, from
bone
South
care
Africa.
plaster. Okay, you tell me when to scroll down. So I'm going to help you to turn the slide.
Thank you very much. Do you hear me, Madam Rainey?
Very well.
Yes, we can hear you.
Clear and loud.
Thank you very much. Sorry, brothers and sisters, for the delay and this technology thing. Thank you so much, Madam Rainey. Thank you so much, Mr. Boatman, for giving me this very good opportunity to share with you today about the bone care plaster, which is one of our great products that we are advocating from today for it to be in our markets. First things first, I'm going to start by defining what a bone is, because our product that we have there is called bone care plaster. So I'm going to define what a bone is. The definition of a bone is a rigid organ that constitutes mechanism of a skeleton. A bone is responsible for balance. A bone is also responsible for the structure that we have. A bone is also responsible for the shape that you see all human being with. There is the effect that we have today. It's about the number of human bones. Generally, an old person has got up to 300 bones. However, I'm saying an old person, a human being has got 206 bones. But when a baby is born with 300 bones, then you can see the equation not necessarily tally, because if we are saying a baby has got 300 bones and then all the adult person has got up to 206 bones, the question is, where are the other bones has gone? Here is the answer, ladies and gentlemen. The answer is that some of the bones, they fuse together. So the bones, as a human being grows, the frame is like the structure of a human being is like the walls, the frame of the walls of a house. And bones, they are therefore to form the structure that you have as a human being. So each time, sometimes when you are exercising, or sometimes when you are doing whatever you're doing, you need to take into consideration how your bones work and how your bones strain as well. Then we have got these products that we are talking of and about today, the bone care plaster. And there is a word that is there, which is care. This bone care plaster has to do with caring. It has to do with concern. It has to do with attention. It helps upkeep. And the bone care plaster is therefore to avoid and to bar harm. There is another word that we have there on the bone care plaster, which is the plaster itself. It is fortunate that the plaster that we have in Greenwald, the bone care plaster, is a medicated, is a protective dressing, is not just a bandage that you might see in the Western treatments. This is a medicated bone care plaster. There are things that I would want to share with you about these bones. Bones generally are made from 3 different kinds of cells. Number 1, which we call the osteoclast cells. Number 2, we call them the osteocyte cells. Number 3, we call them the osteoclast cells. Some of them, they are inside. Some, they make the outer frame of the bones. And when they are intertwined together, they form the rigid organ that we call the bone that ends up makes the skeleton. Can we move on, Madam Rain? So the bones, as they are, we do have 3 major main types of the bones. And these 3 main types of the bones are like this. We have got bones that make blood cells. Somebody might ask you, how are cells made? And how are tissues made? And how are organs made? Combination of cells will form a tissue. Combination of tissues will form an organ. And in this case, we've got an organ that we have, which we call the bone. And this bone has got 3 main types of bones, which is number 1, the bones that are made from blood cells. Number 2, the bones that store the fats. And the bones that form the joints. So in a nutshell, the bones as they are, they have to help the body for formation of cells. The bones as they are, they have to help the body for storage of fats. That's why the bone marrow itself is yellowish in color, which is the color of the fats. The bones themselves, again, they have to form the joints, and these joints, they call the flexibility that we have as human beings and as we walk. Can we move on, Madam Rain? There are common bones and joints conditions that I'm going to put to X-ray today, that I'm going to explain today, and these will form bone-related complications. That's the reason why at the end we need to call for the bone care plaster. The reason is because we have got these complications, these conditions, ranging from arthritis. And when we are talking of arthritis, we've got at least up to 3 major types of them, which today I'm going to share with you. The one that we call osteoarthritis. The osteoarthritis, which is an arthritis characterized by degenerations of the cartilage, which makes the bones and joints to lose rigidity. We also have what we call rheumatoid arthritis. This is a condition whereby the immune system itself fights against itself to an extent that it releases certain chemicals that chops down the bones, the joints themselves. Then in this case of arthritis, it means a person might have untold pains. And these pains, they will need to call for a bone care plaster. We also have what we call scapulohumerus periarthritis. Scapulohumerus periarthritis is characterized by stiffness on the shoulder. It is also called frozen shoulder. So it causes the bone, the joints of the shoulder themselves to become stiff and to be painful. There is also another condition, complication, that is called the cervical spondylosis. This is characterized by wearing and tearing of the spinal discs. You know, a human bones and joints also have some discs, just like a car. However, these discs, they are behind your back. They lower from the brainstem, going down to the spinal cord. And these discs, they are very much flexible, and they make the body to be so much flexible to bend. But whenever they happen to have complications, the condition will call it cervical spondylosis. We also have what we call hyperosteogen. The hyperosteogen basically is an abnormal enlargement of the bone outer layer. So this abnormal enlargement of the bone outer layer, it makes the bone to swell. And when bones are swelling, they become painful. When they are becoming painful, there's a call for the bone care plaster. We also have another condition, complication that we call sciatica, that is characterized by the numbness of the legs themselves. When the legs are numb, you can't feel them, and that creates more harm than good, destruction rather than development. There is need for the bone care plaster. There is also another situation which we call the lumbar muscle pain. The lumbar muscle pain, it is characterized by lower back pain and pains on the hips. Not only the lumbar muscle pain, We also have what we call the lumbar disc herniation. The lumbar disc herniation causes the discs of your spinal cord system to be splitted. When they split, in a nutshell, they are doing what we call rupturing. Ruptured discs, they split. When they split, the pain is untold up until you administer the bone care plaster. There is also what we call the traumatic spinal injury. The traumatic spinal injury mostly is a result of accidents. People, they fall into accidents and they just come out. They say to themselves, they don't want to go to the clinics. They don't want to go for checkups. Then after 6 months down the line, after a year down the line, they begin to experience pains. What we call traumatic spinal injury. It needs the bone care plaster. Then there is this, which is the greatest of all of them. Most women, men, adolescents, adults, they experience this. And this is what we call lumbago. This is a total lower back pain that when you experience it, the only product that will save you from that kind of a pain is none other than the bone care plaster. Then we have the tennis elbow. Some people may think that the tennis elbow is for people who play tennis, but it's just of the condition. This is a result from overuse of muscles and tendons, especially for people who does a lot of exercising. They overuse their muscles. They overuse the tendons. When they do that, they experience the tennis elbow. Not only that, we have also what we call tenosynovitis, which is the inflammation of the bone tendons. When we are talking about bone tendons, we are saying between the other side of the bone and the other side, and there's a joint in between. To make these bones be together, it's not only the joints that is in there between, there are also what we call the tendons that makes the bones to be connected, intertwined together. So whenever these tendons, they inflame or they swell or they experience an infection, then a person experiences tenosynovitis. Then lastly, on the conditions on the bone-related complications, we have what we call the joint sprain. The joint sprain generally is an injury on bone. It is an injury on bone ligaments. These ligaments, someone might ask, what are ligaments? Ligaments generally are fibers that hold bones together. And these fibers that hold bones together, they can strain to an extent that they become painful. And that condition is what we call the joint sprain, which is an injury on bone ligaments. The product that will be needed there is none other than the bone care plaster. Can we move on, Madam Rainey? There we have the bone care plaster, and with the ingredients that you can see from the cross section, according to the slide that has been put, you can see that the bone care plaster generally is not just like a plaster that you can administer from the Western treatment. It's not just a plaster or a bandage that you can just tie yourself. It is a medicinal bandage, a medicinal plaster that has got ingredients in them. And some of these ingredients that have been stated there on our cross section, they are responsible for dispersing pathogenic winds and the dampness and cold and they are capable of easing pain. There is Radix Acon that you can see there. And the last one is Rhizoma zingberia. These ingredients shows that the bone care plaster is not just a mere plaster, is not just a mere bandage, but it is something that has been made according to the TCM. The TCM stands for the traditional Chinese medicine. And that's why you are seeing all those pictures of medicines that are in there. They are combined together to build up the strength that we need, or the medicinal properties that we need in hair plaster. Can we move on to the next ingredients that we have? Because this is the first page of the ingredients that we have in hair plaster, but we still have more. So, Madam Brain, can we move on more of these? These ingredients, as you can still see there, the list that we have on this time now is they are responsible for invigorating blood circulation. And I was searching and seeing that these ingredients stated here for blood circulation system and also for removing blood stasis. When we are talking about blood stasis, we'll be talking about the slowness of blood. Sometimes when a person has got some injuries or some internal bone discomforts, that person also experience what we call blood stasis. Blood stasis, it means blood is built on one place and it's not moving. And when it's not moving, that's when you see either a knee or any joint of the foot begins to swell because blood is not moving anywhere. So when I was researching on these ingredients that we have for number 2 cross-section there, which are responsible for invigorating blood circulation system and removing blood stasis, these ingredients I saw and I was very happy because there is inclusion of Myra and there is also inclusion of frankincense. Those who understand biblical times, they will tell you that the times when Jesus Christ was born, the wise men from the east, they came to the birth of Jesus in Bethlehem with gifts, and the gifts that they had were myrrh and frankincense, among others. Now, in this our bone care plaster, it is more like a miraculous herbal remedy that consists as well with myrrh and frankincense as some of the ingredients that it entails. So you can literally know that we are talking of an outstanding herbal remedy that we need to advocate for it to spread not only in Africa, but all over the world for people with muscle tensions, pains, lumbar disc herniations, traumatic spinal injuries, all those, they need to be attended through our bone care plaster. Can we move on, Madam Rainey? Can we move on, Madam Rainey? That's why we said now the bone care plaster, therefore it's suitable according to our cross section here. It's suitable for people with ankle contusion. When you fall down or you twist your ankle, you walk sometimes in a way that disturbs your structure balancing, then sometimes you fall or you twist somehow. Generally, you see yourself swelling, or sometimes you experience a tension on your ankle. That is what we call ankle contusion. What do you need to do when you experience that? You just take the bone care plaster and you paste it there, then you are done. Not only the ankle contusion, however, we also need the bone care plaster for lumbar sprain. We need the bone care plaster for lower back pains. We need the bone care plaster for cervical pains. We need the bone care plaster on lumbar disc injuries. We need the bone care plaster on wrist sprain. Some people with wrist problems, or sometimes they feel swelling, or they see swelling on their wrist, or they feel the pains on the wrist. The only herbal treatment that you need is a bone care plaster. Some people, they experience shoulder stiffness. What do you need? Ladies and gentlemen, you need the bone care plaster. Can we move on, Madam Rainey? Then, when we are pushing toward the conclusion of this lecture about the bone care plaster, we need to know how to use our bone care plaster. So basically, after cleansing the skin, remove the release paper and stick the plaster on the painful joint. You paste the plaster on the painful muscle. You paste the plaster on the painful angle. You paste the plaster on the painful or the stiff shoulder. Each piece can be used for 2 to 3 days. So you paste it or you plaster it wherever the pain is. It can stay there for 2 to 3 days. Then, if you want to put again, you can wait for 4 to 6 hours before you put the next one on the same position. That's how this bone care plaster is administered. This is how it is administered. At least when you paste it 2 days or 3 days, be with it. Then you remove it after 2 days or after the 3 days. Then if you want to put it again, wait for at least 4 to 6 hours before putting it again on the same position. Can we move on, Madam Rainey? We have general health tips. This is about our lifestyle. And it's normal that as time goes on, there will come a time when our bones and joints won't be the same. Our tendons won't be the same. And we'll be in need of 2 major elements that will be needed for proper bone building and strengthening our bone systems. And these 2 elements are none other than calcium sulfate and what we call collagen. What is calcium? Definitely most of you know that it is a trace element. It is a mineral that is needed for the bones. So we need to enhance it as part of health tips, as part of health lifestyle, before we experience bones, tendons, and before we experience challenges and constraints of our body system, especially our bones systems. So not only calcium phosphate, but also the collagen. Somebody might ask, what is collagen? From this presentation, I'm going to define collagen. Ladies and gentlemen, collagen is a special, outstanding main protein that is needed for bones and joints. A main protein that is needed for bone tendons. A main protein that is needed for our bones is called collagen. Yes, of course, we also need collagen as well on the skin. However, as we are talking about the bones and joints, we say today collagen is needed, therefore, for bone tendons. So these are the health tips that we have there. Following a diet that's health for you, exercising and moving, wearing proper protective equipment, visiting a healthcare provider like us, Greenwood, continuously, regularly, visit us so that we check what is happening. If there is need for these bone care plasters, definitely we'll advise you to test them. Always wearing your seat belt, especially for those who are driving. You won't be knowing when you are going to be having an injury or an accident. So you will have some internal injuries in your body system, and those internal injuries will end up making you experience traumatic spinal injuries. And when that happens, definitely you will be a candidate of the bone care plaster. Can we move on to the last slides that we have, Madam Rainey, which we say thank you for listening. Thank you for paying attention to our bone care plaster, which is one of our great products that we have as a company, as Greenwell. It's not a pest, it's not just a bandage that you can think of. It is a herbal medicinal bandage with a lot of ingredients in it for removing problems that has to do with your bones, your joints, and your muscle pains. Thank you. Thank you. I thank you. Back to you, Madam Rainey. Back to you.
Thank you, Mr. Bornwell. Thank you for your presentation of the bone care plaster. Though in some countries that still this product is unavailable, but we definitely found that this is a very helpful product. So I would like to take 5 minutes to share about the bone care plaster with my personal experience and also the testimonies by one of the great leaders of Kenya. In the last year, in November, we visit Kenya together with Dr. Domini, with Mr. David John and Professor John. We had a leaders camp in Kenya. During this camp, Madam Lucy, Ms. Ngbogo, and their team had a very wonderful, brilliant outdoor team building. Mr. Budiman was also there. We really, really enjoyed it. I remember that there were 2 activities. One is the rope jumping, and I was selected the number 1, the first one representing my team. So I did my level best. To be very frank, for the past 10 years, I didn't do the rope jumping. At my age, which is 52, normally I did some mild exercise like brisk walking, like swimming, because I know, first of all, my knees are not that strong anymore because of the long-term wear and tear for 42 years. And secondly, I'm a bit overweight, so my knees actually carrying more extra load. So I'm very careful with my knees. But at that day, I was really eager to to win for my team. So actually I jumped 90 jumps without stop. And then we also had the running contest. I also did my level best. I didn't run that fast for the past 10 years. Okay, after that, my knees really gave up. I have 2 very painful and swollen knees. So I apologized them during the evening when when I went back to the classroom. Actually, I apologize that I couldn't change my uniform, my suits. So let me just wear my t-shirts and jeans. But I put on the 2 bone care plaster on my knees. Actually, I keep on using it for 3 days continuously. And then, okay, that was in Kenya. So when we went to the first place is Zambia, and then to Kenya, and then Uganda. So when I went to Uganda, my knees are quite okay. So we did another team building there. I also jump and also run. So this is my testimony. Another testimony is, during that time, we had a madam. I forget, Mr. Mbogo, you are there. Is it Madame Dorothy or is it Madame Catherine? I sort of I can't differentiate these two ladies. So actually, one of the lady also had get her ankle sprain. So she had a swollen ankle. So I give her one of the bone plaster. I asked her after 1 hour. So how did she feel? She feels that, the bone plaster, after you stick onto your skin, your joints, first you feel that the herbs goes inside the ankle, that you feel that it's so cool, it makes the pains, less. It alleviate the pain. This is the first thing you feel. So it is so cool, so nice. And then gradually you feel that, then the ankles is not that painful and it's not that swollen, because it will take a couple of days for swollen ankle, to, get back to normal. So normally it takes 3 days or so. But this bone care plaster, you must stick onto and damaged skin. So if you have a open wound, especially when you bleed, you can't apply this bone care plaster. So, but as long as the skin is complete, then you don't hesitate, use it as the first aid. So this is a very important product. So we consider it is a first aid. So actually I carry the bone care plaster to give it to different companies for them to, to study it as an example. So the general managers can introduce those products to African market. But actually I used it, but I'm very happy about the result of the bone care plaster. So this is my personal experience. So thank you. Do we have any questions about the bone care plaster? Okay, so we see that Mr. Kamal from Nevada, Kenya, raise your hand. Please, Mr. Kamal, you unmute yourself. And also, Mr. Mbogo, please, you can unmute yourself and we can have an open discussion. Mr.
All right,
Kamal.
I don't know, Madam Rain, we want Mr. Kamal to start all myself.
Sure, you go ahead, please.
Okay, thank you very much. I also want to appreciate tonight, and you have done it very well. Well, this particular product is relatively new to our branch, but it is moving very, very fast. In fact, today is a very, very nice day or a good day that we have this important information. But I've used this product. 3 of us have used the product. Myself, I'm not used, but Director Lucy have used it when she had some backache. And I've also used it on a 78 years old lady who had some pain on the shoulder due to shoulder spondylosis. And she was not able to sleep. In fact, she could not even use that side of it was the right shoulder. She could not use that side to sleep because of the pain. 78 years old. And when she came, of course, we had to give what Bornwell have also mentioned, our calcium that has collagen, also joint health, plus now the plaster that was put there. Interestingly, and also to our excitement, in the first day, the lady slept very, very well. And when she was turning in her unconscious sleep, when she woke up, she found sleeping on that side, and there was no pain. There was no such pain to warrant her to wake up. So this particular product really has worked. And of course, my friend, Director Lucy, who is my next door neighbor, who always stay with me. She had some pain within the back. I don't know whether it's because of traveling long distance and again driving for long hours. She was having this pain, and they put it at her back, and everything within a night, the pain had tremendously subsided, and in 2 days the pain was normal. Lastly is my son, and this is what I really wonder about this particular product. He did not have anything to do with bone pains. Actually, he had an infection within the chest. He had lungs infection. And this lungs infection had pain emanating from the lungs and now towards the skin. And this one happened it had happened 2 days ago. And when he could not sleep well because of the chest pain, it was put on the chest, and a record 4 hours. He felt now he was more comfortable and he was able to sleep. So this is a very good product, probably not only dealing with some pain which is emanating from the joints, but also some other pains. And therefore, we really appreciate and thank the management for bringing this wonderful product. Especially now we are campaigning on it that other painkillers may have much more of side effect, but this one, not really, no side effect. Thank you very much, Madam Rainey. Back to you.
Thank you, Mr. Mbogo. This was very helpful testimonies from your team. Thank you so much. Actually, it enlightened so many distributors who have tuned in today, because we know that bone care plaster was not quite familiar with some of the market in Africa. So if this product works that well, then please, we can also convey the request from the market to the management, from the head office side, that if it works well, we'll ask the logistic department to make some arrangement to send some samples of the bone care plaster to be put in a different consignment for different market. So thank you once again, Ms. Mbogo, for your wonderful testimonies. And I see that Mr. Kamal from Naivasha also raised your hand. Ms. Kamal, are you still there? Okay, then we see that there's a Goisom. I'm sorry, I can't pronounce your name correctly. If I'm wrong, please forgive me. Please, you go ahead.
Okay, no problem, Ms. Rainey. At the beginning, I had a bit of a problem with the network, so I missed it when it was said in South Africa, we have it in one of the branches. I'm just trying to make sure, do we have it in South Africa, or is still a problem for the South African market? That's my question.
It was available in South African market, but if you find it helpful, you can talk to Mr. Glory to bring some bone care plaster to South African market. Thank you.
Thank you, madam.
Thank you. Do we have more volunteers who would like to share with us and who would like to ask questions? Because we still have some more questions in the chat box, hasn't been answered yet. I can check one about the gel, the women care gel. One question is, does the women care gel leave any dirty after it works? This is also a very important question. Yes, it does. It cleans it cleans the private parts, even the vagina and the the cervix. So you may find that you have discharge that after you use it. So please, ladies, you can use the panty liner the discharge won't be serious, but you know, it could stain of inner pumps. So please, you can wear of panty liner when you're using this women care gel. This is a very important question, and let us see. Okay, in South Africa. Okay, I was diagnosed with carpal tunnel. Okay, syndrome. Can this plaster help in that? Yes, it can help. I would like to try it on me first, then I can be a living testimony. Very good. The point is, where are you based? Which country you're from? I'm not, because you know, from the account we can't tell which country you're from. You know, we hope that you can base in Kenya, so you'll be able to get the bone care plaster immediately. Okay, very powerful. Thank you, Mr. Bornwell. Yes, powerful training. Yes. Okay. Does it help where there is an implant, sir? Does it help where there is an implant? Implant of what? I didn't get this question very clearly. Implant of what? Okay. Does it help fractured arm? It can help a fractured arm, but normally what we know is, you know, when you're fractured, you put on the, you know, the plasters and the bandages all around your arm. So it may prevent this bone care plaster to penetrate into your skin. So if you don't have that, you know, if it is just a simple fracture, you remove the bandages, and when you know, stick it onto your skin, because you know, all the herbs, like Mr. Bornwell has you know, presented, actually there's 16 different herbs, including the frankincense and myrrh. That is true. That is the most important miracle herbs that have been presented to Jesus Christ. Yes, so all these herbs, that they work wonderfully. They must penetrate it from the skin to the bones, to the joints, to where, you know, you have the pain, like Mr. Mbogo has just mentioned. So it must be stick onto your skin. So if it doesn't stick onto your skin, it cannot work. Then excellent presentation. Yes, they love your training. Congratulations. Thank you very much. Thank you. Hope to get back bone care plaster in Johannesburg. Yes, you know, please, Madam Sikanelli Sibanda, you can suggest the management to bring this. Okay, let's see. Answer questions. Does the plaster help where there's an implant? So I still cannot get this. You know, what is the implant? Specifically, you know, as long as it touches the skin, yes, it works. So it penetrates into the skin and into the deep tissues, even if there's implant, because implant, it is enough tissue, inside of tissue. Normally, it is in between the, you know, the skin and the other muscle tissues. Yes, it also works. Okay, of leaders, of two trainers. Yes, thank you very much, of two trainers. Massimo use bone care plaster. Can we combine it with magic pad? Can we combine it with magic pad? Yes, you can use both of the products. Magic pad is for detox, and this bone care plaster is for the pain. And for remember what Mr. Bornwell said, remove the pathogens like the winds, the dampness, the, you know, the evil chi, whatever caused the pain. Okay, can it assist with embolism in the lungs? Not really. No, I can't see this. Okay, can it be used for period pain? Oh, Madam Grace, well, this is a very wonderful question. I haven't thought about that yet. I think, because it removes the stagnance of the blood. Yes, it can be applied. So you can try to put one on the lower abdomen and one at the back. So yes, this is a wonderful idea. Is it part of the bone and joint care package, or it can be effective on its own? Yes, Madam Elizabeth, it works very well on its own, and it can also be part of the bone and joint care package. Excellent questions. Thank you very much. So do we have more questions? Okay, thanks. Okay, thank you very much. So ladies and gentlemen, let's think of two presenters. Madam Macharia and Mr. Bornwell once again. And also thank you, Mr. Mbogo and Mr. Goitz. Okay, I'm sorry, for your contribution. Mr. Budiman, can you help us to close today's presentations?
Sure. I see there's another question. Can it be applied when the client has injured?
As long
Injury.
as injury, we cannot put the bone care plaster on any open wound. So make sure that the skin is complete. There's no open wound. As long as there's no open wound, you can apply. But if there's a bleeding and open wound, please don't use these products.
All right.
Okay, thank you.
Okay. So, all right. Thank you, Madam Reni. Thank you very much, Madam Hannah, Macharia, Mr. Bornwell, Manhungu. You have been doing great tonight. Thank you so much for the training. People love you all. So we have learned a lot of things this evening about the women care gel and also the bone care plaster. So as Madam Reni said, please ask your management in your branch in each and every country if you really think that this product can really move in your country and help your business. So today we have a wonderful evening, and next week we are going to have another great session. I just give you some clue. We have two young trainers from Zimbabwe next week, okay, that will share with us business training. So let's see, let's log in for next week, next Friday Zoom online training, and we learn more and more. So because we want to see you all in China, we want to welcome you in China this year in October 2024. And I also believe Madam Reni is very busy preparing this China trip 2024 to celebrate our 30th anniversary. So, all right, guys, we can unmute ourselves and then we can say thank you and bye-bye to Mr. Bornwell, to Madam Macharia, and also to Madam Reni. Thank you.
Thank you, Mr.
Thank you,
Budiman.
Mr. Budiman. Thank you, Mr. Budiman. Thank you, Mr.
Thank you, Madam Macharia. Thank you, Mr.
Presenter.
Bornwell.
Everyone, good
Mr.
night.
Mbogo, thank you.
Mr. Budman, thank you, Madam Reni. Have a great night.
Night, everyone.
Have a great evening.
Thank
Thank
you.
you.
Thank you.
Thank you so much.
Thank you so much, everyone.
Good night, everyone.
Thank you.
Thank you.
Don't forget, tomorrow Saturday, we have fertilizer training.
Mr.
Professor Jam.
Yes, tomorrow we are going to have
It was
fertilizer
powerful.
training by Professor John. So please be there.
Thank you.